this afternoon, the CDC is now saying coronavirus antibody tests could be wrong up to 50% of the time. KMBC 9's Emily Hallwick spoke with an infectious disease specialist about whether even getting tested is worth it.
In theory, a finger prick could tell you if you've had the coronavirus, but it's not quite that simple.
A lot of these current antibody tests have not been properly validated and vetted.
Infectious disease specialist Dr. Dana Hawkinson says many COVID-19 antibody tests can give incorrect results.
There is still really concern about the antibody tests because you could have false positive or false negative results.
He says there are still many unknowns.
There's a false sense of security about the protection that the antibodies offer you, although we think you will get some protection.
Lee's Summit-based Viracor launched an antibody test earlier this month after getting emergency use authorization from the FDA. The company says a preliminary study showed its test was 100% accurate in finding antibodies in COVID-19 positive patients.
A lot of these companies have very good track records in developing very good tests that tell us the correct answer when we need it. But it is still new.
Dr. Hawkinson says more data is needed.
I think overall we have to be careful, and as we move further, more of these companies will have testing data and validation, and we'll be able to know more in the near future.
Emily Hallwick, KMBC 9 News.
Plasma from people who have recovered from COVID-19 can be used to treat patients with severe cases. The Community Blood Center says it is accepting plasma donations from those with a positive antibody test. It will run another antibody test after collection to verify the results. Here are the latest numbers on the coronavirus. Kansas is reporting 119 new cases today. That's half the number of new cases compared to the last update on Memorial Day. Missouri is reporting 201 new cases and almost 700 deaths across the state. In Kansas, 6.8% of tests are coming back positive right now. The World Health Organization wants that percentage to be under 10 to ensure adequate testing. In Missouri, 7.4% of tests have come back positive since the beginning of the pandemic. Tens of thousands of doctors and nurses have gotten sick from taking care of COVID-19 patients. A new CDC report shows more than 62,000 healthcare professionals have tested positive in the U.S. That's a big jump from the more than 9,200 the CDC reported back in mid-April. At least 291 healthcare workers have died from the virus. The CDC believes the current numbers are possibly an undercount because many of the reported cases do not state if the patient worked in healthcare. COVID-19 is causing another health crisis when it comes to stroke victims. Fear of the virus has people avoiding the emergency room. Doctors say that delay in treatment can be devastating. COVID-19 brought a lot of new health warnings. Early in the pandemic, we were warned to call doctors ahead if we were sick, that it might be safer to self-quarantine. Now doctors fear that caused confusion. At St. Luke's Hospital, neurologists have patients who waited days to get help, even when having symptoms of a stroke.
You never know if it could have been reversed with the clot buster if they would have gotten there earlier. And I asked the patients, what made you not come in? And they're afraid of, being exposed to COVID-19 in the emergency room.
With so many COVID-19 precautions now in place at hospitals and most COVID-19 testing being done off-site, doctors say you should never avoid the emergency room when minutes count.
Billions of brain cells die for every several minutes that the brain's without oxygen. There's only a certain window of time where we have a chance of reversing that stroke, either with the clot busting medication or with one of our interventionalists pulling a clot out of the vessel that's being blocked.
Dr. Old says COVID-19 precautions should be taken seriously, but not at the expense of life-saving treatment.
You have to trust the medical professionals to keep you safe from the COVID-19. I think we're doing a good job of that. I feel like I'm more likely to contract COVID-19 at the grocery store than I'm at the hospital.
To remember the signs of a stroke, remember to B, fast, B, problems balancing, E, eyes, double vision or loss of vision, F, facial droop, A, arm weakness, S, slurred speech or loss of speech, and T, it's time to call 911. And I do have more information on my KMBC Facebook page.